Well, hello everyone, and thank you for joining me here today. We are gathered on the traditional territory of the signatories of Treaties 6 and 7, and I'd like to acknowledge the Métis people of Alberta who share such a deep connection with this land. Here we are in Red Deer on day 2 of this important provincial election. I am so happy to be able to be here to talk to the people of Red Deer. I'm joined today by Maureen, a family physician, and along with Norm and his wife, former patients of the Red Deer Hospital. We're also here with Michelle Bear, our incredible candidate for Red Deer South, and Jaylene Tweedle, our amazing candidate from Red Deer North. Now, yesterday, I began the conversation with Albertans about our plan for a better future. And I promised that I would start by delivering better health care from day 1. Right now, about 800,000 Albertans don't have access to a family doctor. And my message to every one of those Albertans is this: if you need a doctor, you will get a doctor. Our Family Health Teams plan is built around your priorities. You have access to a doctor who works closely with other professionals, like nurse practitioners, registered and licensed practical nurses, mental health therapists, pharmacists, social workers, dietitians, community paramedics, community health navigators, physiotherapists, midwives, speech-language therapists, and more. We will make major transformational changes, such as supporting flexible hours for family doctors and health professionals across the province. Extending hours to include evenings and weekends is actually something that health professionals have been asking for, from the government for years. And it's also better for working families, working parents, some of whom struggle with taking time off just to make it to a doctor's appointment. We'll also invest $350 million over 4 years to build and renovate 40 new family health clinics to ensure Albertans across this province get their concerns addressed faster. And we'll invest $400 million over 4 years to hire family health team members, adding 4,000 allied health professionals to primary care. And for the record, with all of that, you will never, ever need to take out your credit card to access that fabulous health care. People across central Alberta are arriving at our hospitals with longer wait times than before, sicker than before, and doctors and nurses working in these emergency rooms can trace back the chaos they are experiencing to the collapse of primary health care in Alberta. But access to a family doctor isn't a reality for a growing number of Albertans, and here in Red Deer, that number is astonishing. Starting earlier this month, 0 family doctors listed on the Red Deer Primary Care Networks Fund or can find a doctor website are actually accepting new patients. And it's deeply concerning that the UCP has had 4 years to come up with a plan and they still have nothing to show for it, which is a far too common experience specifically for the residents of Red Deer when it comes to their health care. Capacity issues have left patients lined up along the loading bays in the Red Deer Regional Hospital, only to be airlifted out of this city because there simply isn't any room left to treat them here. And the UCP Infrastructure Minister, Nathan Neudorf, well, he had the audacity to brush off concerns about delays to the project, saying it would be too tedious and time-consuming to explain those delays. Well, that's unacceptable. Red Deer is growing and it deserves a hospital. So, in addition, and for the record, we will also be building the new Red Deer Hospital. And I think that we're going to want to see one of our new family health team clinics go right inside of it as we do that. Now, you know, members of the media have already met Norm, and he shared his own experience with you in March. And he made it precisely clear why we desperately need to take action on the Red Deer Hospital. And so what I'm going to do, and so we're so grateful to hear about his experiences. So now I'd like to introduce Maureen, an incredible family doctor who has been practicing for over 35 years. And she will tell us just a little bit about her experience too. And thank you to all of you for being here today. And now I'll turn it over to Maureen to say a few words.
Good afternoon, everyone, and thank you for having me join you today. My name's Maureen McCall. I've been a family doctor for over 35 years, and for about 30 of those years, I've been here practicing in Red Deer. I've cared for patients on every ward and in every department of this hospital during that time. And we have needed more beds and services to appropriately care for Central Albertans for many years. Especially in the past 5 years, my practice is focused mainly on hospital care, and I witnessed a huge stress on patients, families, and hospital care teams when there is a constant pressure to discharge patients as quickly as possible to make room for those waiting in the emergency room for care that they can only receive at our hospital. Our doctors, nurses, and care teams that help keep our hospital running work as hard as they can to provide the best care possible. Our jobs have always been demanding, but they've been so much more difficult when the system is overburdened and caregivers feel unsupported. Supporting family doctors to maximize collaborative, team-based care in their existing offices and in new ones would go a long way to reduce the number of patients inappropriately seeking primary care through the emergency room and to attracting new family doctors to come to Red Deer. When I retired from my family practice 5 years ago, I could not find another doctor willing or able to take over my wonderful crew of 2,000 patients. It would help reduce the burden on my colleagues in the hospital and ease strain on family doctors' clinics in this city. We know that reducing the burden on acute care settings like the hospital is important, but we clearly also need to prioritize investment and complete the Red Deer Regional Hospital expansion as soon as possible. We can't continue to provide excellent quality care when our facilities and healthcare workers struggle to handle the overwhelming demand that we're seeing today. We need to take better care of our patients and our healthcare workers. I'm grateful to Rachel Notley and to the Alberta New Democrats for their leadership on this issue. Families in Red Deer have been waiting for the UCP to make good on their promises, but here we are 4 years later. Without the larger hospital that we desperately need with their leadership. We can't keep putting people's lives at risk. Transporting critical patients to Calgary or Edmonton isn't a sustainable approach in the long term for anyone involved. Thanks very much.
Well, thank you so much, Maureen. And you are correct that the other thing that is also so important to know, a 90-minute ambulance ride for emergency treatment to a different city, it's not healthcare. It's risky, it's dangerous, it's chaotic, just like Danielle Smith and the UCP. So you have my word, the Red Deer Hospital is our top priority. Everything in our power to accelerate its completion, and we will provide stable, competent, and transparent leadership throughout the process. We'll make sure that families across Red Deer get the better health care they need. And once again, if you need a doctor, you will get a doctor. So thank you, and we'd be happy to answer any questions folks might have.
All right, we're going to start with a couple folks we have here on location. If you want to come over here so we can use the microphone. For those of you who are on the phone or on Zoom, please use the raise hand function or push *9 on your phone. And please introduce yourself and the outlet. And I'll just hand it over.
Hi, Susan Zielinski with the Red Deer Advocate. I was hoping you could go through maybe how would you characterize the NDP's stand or record with the Red Deer Hospital and the expansion project?
Well, as you know, when we first got into government, the Red Deer Hospital was not as high on AHS's priority list as it needed to be. In early 2019, we committed that the Red Deer Hospital would get a significant rebuild. And in fact, what it then happened was the UCP matched that commitment. Unfortunately, 4 years later, nothing's been done. So we are back here to say that we have put a lot more thought and time into our commitment. We will roll out a platform that will include a $150 million expenditure next year, and after that, $300 million. We expect that we will be getting shovels into the ground no later than 2024. Because we know that this is long overdue. Healthcare demands and pressures in central Alberta have increased dramatically over the last 5 years, and this has become the number one priority, and we'll get it done.
Hi, I'm Alessia from RD News Now. My only question really is, we've heard from both sides like what their plans are to do in healthcare. We've heard about the family health teams, that the NDP wants to put out. Is there any new information that we can provide for Red Deerians on your plans for healthcare?
Well, twofold. I mean, our plan, of course, with respect to the family healthcare teams is to make sure that within 2 years, roughly $400 million is invested in expanding access to family medicine for at least 100,000 more Albertans. So you're going to see real results very quickly. Moreover, when it comes to planning and putting the final plans in place for this hospital, where we want to see shovels in the ground next year, we are going to make darn sure that there is a family health clinic inside the new and renovated hospital to make sure that more people in Red Deer can get access to good, solid, comprehensive family health care.
We're going to go to questions on the phone now. We'll start with Alana Smith of the Globe and Mail. Alana, please unmute and go ahead.
Oh, just checking. Can you hear me?
I sure can now, Alana. Yep.
Oh, awesome. I have a question for you just about EMS dispatch. I know there's a press release that was put out today. It was the cities of Calgary, Lethbridge, Red Deer, and Wood Buffalo, and they just highlighted continuing critical issues with EMS dispatch. So I'm wondering what the FP's plans would be for that if they were to take place.
Well, as you know, AHS was pushing very aggressively to consolidate dispatch when we were in government, coming into government in 2015, and we heard from many folks that this was not going to work. So we put the brakes on it because we knew that there needed to be more community engagement around dispatch. We can't have a situation where people in Red Deer are literally waiting for hours for an ambulance because the ambulance itself is an hour or 2 hours away in a different community. And we've also lost the benefit that often comes with integrated service between ambulance and fire. So back then, we put a pause on it and we said, no, we need to do better, and we didn't move ahead with it. When the UCP was elected, they immediately moved forward with that consolidation over the objections of, as we know, Calgary, Red Deer, Lethbridge, Fort McMurray. And so our position remains the same. They've moved ahead now. What we would do immediately is include that decision in the overall review of ambulance services. We've already committed that we will engage with municipal leaders to do an analysis of what's worked and what hasn't worked, and what we can do to develop better service for specific Alberta communities. And that work will be paired with the commitments we've made to improve ambulance services overall, including recruiting more paramedics so that we actually have more humans inside the new ambulances, and improving their conditions of work so that we're able to recruit more folks into that line of work.
Alana, did you have a follow-up?
You? Oh, it just keeps muting me. Can you hear me now?
I can hear you, yep.
Oh gosh, sorry, I'm having trouble on this then. Technology. Just another question on the EMS dispatch. So fair to say you wouldn't necessarily reverse the consolidation or the consolidation and do a full review. And then my second question is actually, you've announced there's going to be a review of quite a few things that are healthcare related. Obviously, earlier you were talking about you're going to review that have been contracted.
Sorry, you are bouncing in and out, Alana. So I think what I heard you say is if you ask for clarifications about EMS and then you ask for clarification on surgical initiatives. So let me say this. We know that EMS is not working, and we have already said very clearly that we are going to review it with a goal to fixing the problems that leaders in Calgary, Lethbridge, Red Deer, and Fort McMurray have identified. Because the situation has changed from when we were last in government, we will have to look at how we can, unscramble that egg in a way that achieves the greatest level of service for Albertans and the greatest ability to respond to local needs and the asks of local leadership. So we will move quickly on it because we understand that ambulance service is a real problem and that there is opportunities that we can provide if we properly integrate with fire services. On the issue of surgical health, private surgical health, what I have to say is we have to look at the contract before we can absolutely declare what we'll do. But from what we've seen so far, the new surgical contracts that Danielle Smith and the UCP have signed are unlike any of the previous ones, and they stand to significantly distort healthcare across Alberta so that the wrong people are getting faster health care at the expense of those who are more sick and in greater need. And that's exactly what happens when you start pulling apart healthcare and selling off delivery of that healthcare to friends and insiders. So we will be taking a very hard look to trying to undo the damage that we actually know exists as a result of the recently announced chartered surgical facility initiatives by the UCP.
We have time for one more question. We're going to go now to Catherine Grikowski. Catherine, please unmute yourself.
Thanks very much. I want to follow up on something that you said at the last news conference in Calgary. There was a mother who was talking about how if she had the money, she could have paid for an MRI. And there is this system in Alberta where you can get imaging done at faster for an expense. And I just wanted to clarify whether you will be doing this doing anything to address that part of the privatization of the healthcare system, or whether, as you said earlier, it will be about doing what's most cost effective for the system.
Well, I wasn't actually speaking about her issue around the MRI. What I was talking about there, Catherine, was she was talking about how something as simple as an ear infection ended up having to be treated in an emergency room because there was so little coordination between the various and sundry people who cared for her son, who had somewhat complex medical needs. And the point that I was trying to make there was that a family health team approach to providing family medicine would have avoided much of the confusion that she was faced with. And I think certainly when we look at family health, provision of health teams, we will look at ways in which we can accelerate access to important diagnostic services. And that's been a long-standing issue. That's slightly different than some of the other ones that we're talking about right now with respect to diagnostic services. What we want to do is make sure that our basic family health care is provided well, and that we stop Danielle Smith from charging you for that. And then we also want to improve access on an equitable basis to all the other kinds of services.
Catherine, do you have a follow-up?
No, that's okay. Thanks.
Well, that's all the time we have then, and all the questions
Thank you
we have.
very much. Have a good day. Thank you.